The appearance of the first teeth is a big event in your little child's life, but it can be tiring and uncomfortable for him. The more you know about teething, the better to help your child get through this stage, with less fatigue and effort. The following lines take you on a journey to talk about a stage teething in infants, and how you can deal with it. What is teething? Teething refers to the rise or appearance of new teeth in the gums. Teething can begin in infants as young as 2 months old, although the first tooth usually does not appear until about 6 months old. Some dentists have noticed a specific family pattern of teething among children in the same family, whether early, intermediate or late, and children who have not been in their first year for 18 months must undergo a checkup by their pediatrician. The first tooth that appears is usually one of the central lower cutouts, and when the tooth penetrates the gums, the area may appear red or swollen above the tooth. Sometimes a fluid-filled point can be seen resembling the blood point in the area around the teeth that has just appeared. Some teeth may be more fatigued than others. The first tooth may be the most tiring for your child and you, and sometimes larger molars cause greater discomfort because of the larger surface area you need to cut into the gum tissue in order to appear. Signs of teething. Many children experience some fatigue and stress in the teething phase or not, and parents, as well as children's health care providers, often attribute any trouble stalking during this stage to teething. Most children start getting their teeth between 4 and 7 months, and some may be late for this time, and as the time of the appearance of teeth varies from child to child, teething signs are also not the same in all cases, but may include swelling of the gums, tightness and crying, rejection of food due to the pain of the gum area, slightly elevated temperature, biting or wanting to chew hard objects, putting hands in the mouth, too much saliva, changes in eating or sleeping patterns, mild rash around the mouth due to skin irritation due to frequent salivation, rubbing the cheek or ear area as a result of saliva pain that occurs during the appearance of teeth. Teething can be painful and hard, but it doesn't cross and doesn't usually cause children to get sick. You should contact your doctor if your child is suffering from diarrhea, vomiting, a fever of more than 38.3 degrees Celsius, or cough, which is not a natural sign of teething. Calming the baby during the teething phase. There are some home remedies to soothe your baby in the teething phase, but you should know that what is good to calm your baby may not be good to calm your baby. You may need to try different things to help your baby feel better. Often the gums improve when the gums are put gentle pressure. For this reason, many doctors recommend gently rubbing your gums with a clean finger or making your baby bite on a clean towel. Often, something cool in your baby's mouth helps make you feel some better. Try a cold lollipop, a wet and clean towel or cold teething toys, and make sure you clean teething toys, wet towels and other things after use. Cold bodies may help reduce inflammation, and frozen bread or frozen bananas can also be used, but be careful to avoid long contact with very cold objects on the gums. Also should not put anything in the baby's mouth that may lead to the baby's suffocation. For example, try to dip your fingers in cold water and massage the gums before each feeding. This may prevent them from biting the nipple during breastfeeding. Teething necklaces. They are necklaces placed in the baby's neck to relieve the pain of teething, and it is said that this necklace relieves the pain of teething by biting the child on it, but child health experts do not recommend teething necklaces, and they consider that they are very dangerous. They can suffocate the child and can cut the necklace and swallow the beads that contain it. If you choose to use one of these necklaces, make sure you put them on your baby's wrist or ankle and not around your neck. You should also keep a close eye on the baby when wearing them and take them away when you're away from your baby, even if you're going to stay away for a very short time. When should I go to a doctor during teething? Because teething is very common, and other symptoms such as fever, colds, and diarrhea are also common, both may occur at the same time. Teething may not cause these symptoms, and it is likely to cause other diseases or disorders, such as viral infections, fever, nasal congestion, cough, and diarrhea, so it is important to contact your doctor if these or other symptoms occurred to your child. It should not be assumed that these symptoms are due to teething and nothing else. Use of medications to relieve teething pain. The medication you're snorting on your baby's gums may not help stop teething pain, because it's washed quickly in the mouth, and there's some controversy about the use of pain medications in teething. A small dose of painkillers may help children, such as acetaminophen or ibuprofen, but you should consult your doctor before giving any medication to your child, and you should also use the drug as prescribed by the doctor and at the dose he sees. You should be careful not to overdo it in the teething stage. Medications may hide some important symptoms that may be important to know. How do I take care of my baby's new teeth? Even before the first teeth appear, the gums should start to be cleaned twice a day using water and wash after eating is effective and simple. Fluoride has proven to be very effective, but your pediatrician or child's dentist should be consulted regarding any supplements that may be necessary, because an increase in fluoride can cause fluorine poisoning, and fluoride is one of the minerals naturally present in water and food and is added to many of the industrial products such as toothpaste and mouthwash.